Hello everyone, good evening, and thank you for making the time to join us for this webinar. We are coming to you live from the RWA offices in Dublin and from across the UK, from the Isle of Wight, and we're going to spend the next hour discussing data. So the topic of tonight's presentation is using data to enhance patient interactions and grow your profit margins. Now I'm going to be joined by an expert panel this evening, so let's introduce them to you. I have Andrew Lane, Chair of the NPA. We're also joined by Gary Warner, who is Managing Partner at Pinnacle Health, and from RWA, my colleague Adele Curran, who is our Chief Customer Officer. So good evening, speakers. Welcome to you all.
Thank you. Evening.
And a very big welcome once again to you at home, whether you are watching us from your pharmacy, your living room, or your home office. We do appreciate your company, and we hope you're going to get a lot of value out of tonight's webinar. Just to remind you all, the discussion tonight, we would love for it to be as interactive as possible. So do please use the interactive panel that you should be seeing on your screen to type your questions to the panel. Please do type away as anything occurs to you as we move through the presentation. Before we actually get any questions from you, though, one of the first things I want to do is actually put a question out to the audience. Now, you don't have to answer immediately because this will be running throughout the webinar, but we are asking you a poll this evening. You should be able to see it now through using the buttons on the right-hand side of your screen. But before we go through what we think are the best drivers of patient loyalty, we want to know what you currently think. So the question is, in your pharmacy business, what is the best driver of patient loyalty? You've got four options which you should be seeing there. So are you seeing it as A, deliveries, B, nominations? And I think that's an option for our English viewers only relevant to them. Services or electronic repeats. So do please cast your votes when you get a moment. I'll be keeping a track on that as we go. And once we have a solid result, we'll be putting that to the panel to get their view on things. Okay, so that's the introductions put aside. Now, the topic of this evening is data and how we can best use it to enhance the quality of patient interactions, how we can use it to drive profit in pharmacy. But because we are data heads, it's impossible to discuss data without first putting it into some context. And to put it into context, we're going to use some of our own data that we've prepared already. So before we get the opinions of Andrew and Gary, I'm just going to hand across to Adele. And Adele has prepared some information for us just to show what's really been happening across the UK in the last 6 months. So Adele, if I can pass over to you, I look forward to seeing what you've got for us.
Great stuff. Thanks, Paul. Okay, so kicking off, basically what I wanted to do here was just kind of give the audience an idea of what kind of revenue is coming from the services across England and Wales at the moment, what the services have been over the last rolling 12 months, and what is our expectation of how we're going to gain more profit and more revenue stream from our services going forward. So on this particular side, we're looking at the DMR claims for Wales, also the emergency contraception consultations and the MURs. Now, I know the MURs is a service that has been discontinued in Wales in the current NHS year. The reason why I've actually put this here is to kind of give evidence of what kind of revenue is missing from your service stream going into 2021, and how are we going to increase our revenue to cover these MURs that aren't available anymore. If we just look at just going to the DMRs and the ECH claims, what we're looking at here is a trend of those claims across the last 6 months. So you can very clearly see the impact on the services of the COVID pandemic in March and April. The ECH consultations fell off the chart in March and April and came back in May and June, and have kind of come back to a kind of a stable enough level, nearly back to where they were in January. The DMRs, the Discharge Medicine Review, it fell off, but it was never a very, very big service to begin with. So the revenue stream and that probably didn't have as big an impact as the emergency contraception. I suppose the big thing with the emergency contraception is, did it fall off the chart because we were all locked down and not able to go out anywhere? Or are we expecting a baby boom in January, February next year? So, if we're expecting a baby boom, let's look forward to our folic acid and our front of shop offering in terms of maternity. So it's always good, planning forward in times of pandemic, and potentially this is one that we could plan forward for.
I hear a lot, Adele, in sort of newspaper opinion pieces that we're headed for a COVID baby boom. So we're seeing hard evidence of that here today. A scoop for the webinar.
This might be an indicator of it, all right. But this is just a small snapshot of the Wales data. So it does indicate that definitely the service wasn't being used in March and April. But it again could be because everyone was staying at home.
Okay.
Okay, so then let's have a look at the England services. So we have, again, MURs in 1920, which we know are cut down drastically for the 2021 NHS year. The NMS claims were rising to quite a peak before the pandemic hit, fell off then quite dramatically as we'd expect, and actually since then has kind of come back to not the same level, but definitely a growing back again, which is a pity because it took a long while to get the NMS service fully engaged, and we were at the highest that we've ever been in the NMS service in England in February before COVID hit. So, I would hope that the industry will get back to there and further and higher in terms of new medicine service for patients towards the end of the coming year and into early next year. I've also put in there, just to give you an idea of the level of home delivery fees for the COVID pandemic that have been brought, probably not revenue into the pharmacies, but have helped compensate some of the overheads and some of the extra expenses that the pharmacies did have in terms of delivering to patients through the pandemic. There was obviously the voluntary service was there, but it looked like through the numbers that we've seen that people more opted to getting a personal delivery from the pharmacy rather than using a volunteer that they either didn't really know or the pharmacy didn't really know. So that's a good indicator that the patients trust the pharmacy to deliver their medicines for them. And it was good to see that there was a help to the pharmacies in terms of this fee to help them cope with the overhead and the extra cost of getting these deliveries to the patients.
It's worth just reflecting for a second as well, I think, Dal, just on the size of that number for a service that had to come into being really as a response to the situation we found ourselves in. 1.7 million deliveries. I'm not going to put you on the spot and ask you to calculate how many deliveries a day that is, but I'm guessing the number would be pretty high.
It probably is. It probably is, and it's a credit to the pharmacy across England and that they took up the reins on this delivery service, where a lot of pharmacies were offering a delivery service prior to the pandemic. They weren't doing anything in terms of the deliveries that they started doing when the pandemic hit. I suppose it was a case of you kind of had to move on and do the delivery service and adopt it really quickly, or chance losing patients to an online pharmacy that would deliver direct to the door for them. But the pharmacies moved very quickly and adopted very quickly in terms of the pandemic, and I suppose it's a good representation of what can be done when needs to be done very quickly. Okay, so then the other one, the trend line here that we're looking is we spoke about it just a second ago there in terms of the trend of MURs and NMS in England. So we see that the MURs obviously were falling off anyway. We had less MURs to do this year, so they were kind of dropping off. But you see there the February figure for the NMS. That was the highest ever a number of NMS claims in 1 month since we went live. And it fell off, and it fell down and right down to the lowest level there in May. But you can see that people have started picking it back up again, and through our own data that we're seeing directly from our own customers, we're seeing that increase in July, August and September is going to reflect a bigger picture, and the line is not gradually going to rise up, it's going to rise up again fairly quickly. So people are adopting back to that NMS service for the patients very quickly. Okay. So just, I suppose the next thing that I wanted to kind of talk about was the flu service for 2021 season. Obviously, what we have here is a picture of the flu claims that went from pharmacy into NHS last year. So in the blue, you can see that in England, we did 1.4 million flu claims. In Wales, we did 63,000. The predicted increase is at least 50% increase. And I suppose if you look, that's quite a remarkable increase in terms of numbers. I suppose the reason that I wanted to show this particular image is, I suppose, to ask the question either of the audience or of the rest of the panel in terms of the preparation that has been done since March or April in terms of being able to get to these numbers. If we're anticipating that the flu season is going to be 2.1 million in England, do we have the capabilities to do it? Do we have the infrastructure to do it? Do we have the flu to do it? Can I ask any member of the panel, maybe Gary, if he's got any insights into the I suppose, Gary, you're on the front line in terms of, putting together the flu on the PharmOutcomes, but also as a pharmacist yourself, have you seen a big uptake in terms of the flu for this year so far?
So from in my pharmacy, we're going to run out on Thursday.
Okay.
The total amount that we would do throughout last season.
Wow.
I'll talk about the actual national figures. I had a word with my colleagues in London Sonar, and so they give me their figures. So I'll put those two together so that you can have that during my chat. I think availability of vaccine is actually the limiting factor.
Okay.
So there should be sufficient in the market. Sufficient was brought in, but it won't be all front loaded like it has been. Last year we saw some phasing. This year we're seeing even more phasing. So it will be a much longer vaccination season, which in some ways is good. But given the rate at which we're vaccinating, I think the funny thing is, as predicted, the capacity and the enthusiasm in community pharmacy is there. The capacity and enthusiasm for patients to be vaccinated in pharmacy is definitely there. It's going to be about whether we have enough jabs to put in arms.
Okay. So do you think that predicted 50% increase is a bit on the low side?
I'm not the betting man, I don't even do the Grand National, but my business partner Kevin and I have a little side bet, and I have bet him. I will give him £5 if we don't do 1.8 million, and he will give me £5 if we do over 2.1. So I think your graph there is pretty much the sweet spot. If we can get the vaccines, we can certainly deliver that, I believe.
Okay, so thanks for that, Karen. I'll just put that out to the audience at home. I can see we've got some good questions and feedback coming in already. So what do you think of that? I'm not suggesting Gary is going to cover all bets, but we've got two figures there, the 2.1 million. I think 1.8 was the other figure that Gary gave. So let us know what you think. Let us know, again, how long do you think this flu vaccination season is going to go on for, because it seems like it's definitely going to be a challenge for us.
I can maybe add, Paul, if you want. We had up to the 21st of September, the Southwest figures in. So I'm in Gloucester. I chair an LPC in Gloucestershire. And we had the total vaccinations by area. And there were 31,000 vaccines to date in the 40 days to the 21st of September. So that's pretty staggering. I think that's up. I think that was up 25-30%. Gary probably's got the exact amount up on the previous year. Now, you'd probably be aware, the audience will be certainly aware, that the normal flu season, we do that planning in February, of course, and this was pretty much before COVID was even kicking in this country. And I think the issue we've got now is, at that point in time, we put our orders together for a normal flu season. And then along came COVID. And, with Matt Hancock certainly raising the bar in England, only a month ago, saying this is going to be the biggest flu season. Make sure you get your flu jab early, because you don't want to have that at the same time. If a COVID vaccination comes through, you've got to have a 10-week gap between the two. So obviously there's a real demand pressure on pharmacies to achieve that. We've been in the press like no one else, I don't think. I don't mean the National Pharmacy Association necessarily, but pharmacy generally has been in the press, on the news. The doctors are pushing us like never before. I think it's great to see that demand, as Gary's saying, has culminated in the existing stocks pretty much running out. Now, fortunately, when the pandemic hit Britain, the manufacturers were told to go and keep on producing vaccine. And I think the latest, Gary might sort of correct me, but I think the latest date on that is sometime in November, when the next run of stock will be available to both GPs and pharmacies. And again, it's certainly, we as the NPA will be pushing hard to make sure that pharmacy does get equitable access to, along with GPs, to that stock when it comes, because the demand will not cease. Obviously, between now and then, we've got to manage what is a very tight pool of vaccines available currently.
I agree, Andrew, and I think we've got some opportunities here for collaborative working with other providers, GP colleagues, to make best use of the vaccine that is available currently in the market. Mr. Hancock has made public that he wants to see 30 million people vaccinated. He's confused everybody by saying, the 50 to 64-year-olds and people that have seen the headline and haven't realized actually that never happened. That might happen later in the season. I can see there's a couple of questions. Hello, Raj. Hello, Prakash. You're in the same situation as I am, in that I phoned up once I saw how quickly it was going, and my supplier of ATIV said, nope, no more. The Department of Health has bought it all, was what I was told on the helpline. So that will be a managed stream. We vaccinate under a PGD, so we need licensed vaccines. And we know the Department of Health should know that, because they wrote the PGD. So at some point it will switch from a market, potentially switch from a market to a supply-driven approach, or they may just feed that into the market. We don't know yet. It would be nice to know, but I think at the moment the message is let's get people vaccinated as quickly as we can. We're better having no vaccines left, and then it becomes somebody else's pressure point. So I wonder actually whether we need to collect the data about how many of us have run out of our flu vaccines. And that's something certainly in a moment I'm going to write down and go and ask somebody tomorrow.
See you again this time next week for the answer.
I doubt it.
Excellent. Okay, Adele, do you have more to show us, or is that the?
Yep, that is it for the minute. If anybody has any questions in terms of any of the service visuals that I showed, please stick them in the Q&A there, and I'll answer them when I see them. But yeah, in the meantime, I think I'll just hand over to Andrew, or unless Paul, you have.
No, I think we're moving on to Andrew now, who's going to, I think, sort of pick up on some of what you said. And certainly for me, just looking at those figures, Adele, what I realize is, yes, community pharmacy is looking to move always, I suppose, to a sort of point where it is engaging more with patients, not just in dispensing, but with services. But there are already an awful lot of services nationally being done at this stage. So there's a very strong base already of community pharmacy working with patients in that way.
There is, yeah.
Okay, well, I can pick that up now if you wish, Paul. Our view certainly at the NPA is that data is key to everything. We've seen in your slides just now how we've sort of talked around various issues facing pharmacy that we probably wouldn't know about unless we had the data in front of us. And I think something that was obvious to us in one, campaigning for our members to make sure that they were being listened to by government. A lot of that went to the funding and the issues that we have still around funding, but it kind of got us thinking that we know the public are on our side, but actually, did we have any real data to demonstrate that the public were on our side? And community pharmacy has really proved itself to be the front door to health throughout the pandemic. And that's a phrase, the front door to health, that we've now managed to get the Secretary of State, Matt Hancock, talking about, which is absolutely brilliant. So if they're starting to talk our language, we are getting the message across. But through the early stages of lockdown, the only facilities, as we all remember, open to the public were community pharmacy and grocery stores. And as a result, the network was under huge pressure to cope with an unprecedented level of prescriptions, staff shortages, problem with PPE availability, and medicines stock supply issues. And due to those heroic efforts from community pharmacy, the network's in a strong position to be recognised as central to the NHS, and everyone's played their part in that. Pharmacy can do so much more, and yet this funding remains a precarious issue for many contractors. And the public, as I've just said, back pharmacies playing a greater role in healthcare. And based on the survey we did in July, I've just put some of the headlines up here, really. It was a pretty big survey. There's over 1,000 members of the public contributed to this. And it was clearly obvious that we could use some of this data to play back to government on how important the public saw us, certainly during the pandemic as well, to their survival, really, particularly if they relied on medicines and the medicine supply chain. 74% want to see locally based pharmacies better integrated with other services, operating as neighbourhood health and wellbeing centres, and providing that face-to-face advice. It's really interesting because I saw Matt Hancock at a pharmacy on the Edgware Road. And one of the things I think when we'd just done this survey that was quite obvious, that 74% who wanted to see that face-to-face was really, really key in our messaging. And I think where we'd obviously seen the doctors running for the hills and operating behind closed doors on a very much a triage phone and triage internet service, and many still are doing that now, that face-to-face advice was absolutely what the public wanted. And I think that is something we played back to the Secretary of State very loud and clear. And we did a run of this data in front of several key government representatives, and they really did listen, because obviously this was the public talking. So as I said, we really love data. So coming to the next point, only 11% supported large-scale automation of pharmacy services with a centralized dispensing model and pharmacists working predominantly from GP practices or remotely. And that played to that point that I've just described, that people love the face-to-face. But without the data, we didn't know. We're having Amazon sort of now scaled up, of course, during the pandemic, and many people have used Amazon for all sorts of stuff. But the public actually want to see pharmacy providing a face-to-face service. They really value that. And so this data was really important in pushing that home. And, I've just said pharmacists currently enjoy huge public support. And 81% of the public actually holding a favorable view of the sector. And that's actually close to the level of doctors and nurses. And it's up 15% from what it was in 2016 when we went on that campaign around funds before. The interesting one as well, that during the pandemic, 55% of the public visited a pharmacy to collect prescriptions, despite some of the issues around availability of PPE and the public's fear about catching the virus. And they were going during the height of the pandemic to buy medicines and to seek medical advice. 89% of the public believe pharmacies are playing an essential role in the crisis. And again, that's something we've played back time and time again to the ministers, to the point where we now have Jackie Doyle-Price, who's the chair of the all-party pharmacy group, who plays back these stats ad infinitum at every opportunity she gets. And she was in the House just the other day, and we managed to get a question for Jackie to place to the PM. And again, we hear the stats that we've pushed towards ministers being repeated, and it's absolutely fantastic. So, one aspect of data being absolutely key to any strategy as well, that any organisation like ours. The PSNC equally came out with some fantastic data, and I will drop just into the next slide for some of that. So can't remember, Gary might be able to tell me when it came out. Again, it was just less than a month ago, I think, Gary, wasn't it?
It was, yeah.
So this data, again, was absolutely key in where we take pharmacy in terms of its value, how we demonstrate its value, and the 600,000 walk-in consultations that have gone to community pharmacy in the last 6 months instead of GPs. And that's based on the PSNC audit carried out in June and July. And that audit indicated that during an average week across English pharmacies, over 600,000 consultations are carried out to respond to patient symptoms. And nearly 185,000 consultations are carried out where pharmacies give patients additional support for a known medical condition. And during that audit, 92% of consultations resulted in advice being given by the pharmacy team. The pharmacy was able to provide appropriate advice along with a sale of a medicine in 49% of consultations, and appropriate advice alone in 43% of consultations. So again, the power of the data. Bullet point 3, fewer than 10% of the consultations recorded in the audit resulted in patients being referred to their GP. So, the majority didn't need to go to their GP. And 49% of patients said that if pharmacy had not been there, they would have visited their GP. So again, that's the evidence to demonstrate that we are saving time for people visiting GPs when perhaps they don't need to. A further 5.7% would have visited A&E, walk-in centres, which would have resulted in another 57,000 appointments per week. So I think extrapolating some of those results, the last bullet point here of that national audit, taking away pharmacy advice would result in approximately 492,000 additional GP appointments each week, or 65 appointments in each GP practice each week in England. And that's obviously something we can put a value to and a cost. Community pharmacy will clearly play an even greater role in the flu service, as we've just talked about. And the pandemic has caused other changes too. The public acceptance and expectation of virtual consultations and services is changing our operating environment. And there are opportunities and risks to changing demand, which use, the smart use of technology and patient information. But it can provide pharmacies with a competitive advantage. And I think, again, it would be remiss of me not to repeat what I said earlier. I'm a real exponent of the data here. And data is key for making your case, whether it be locally to local commissioners, whether it be at PCN level or ICS level, or in the PSNC's case at national level when we're making the case for the value of pharmacy. So data is absolutely key. And you guys at RWA, you are past masters, data maestros, whatever you want to be called. Without the data that you cut and put back to us, we wouldn't be able to have sensible conversations with the people that effectively control our future. So I think it's been great that, we've seen a resurgence in our interest in using the data in a very, very concentrated way and a defined way that actually demonstrates our value. So I'll shut up now. And
well, thanks very much for that, Andrea. Adele, I don't know about you, but I think I quite like being referred to as a data maestro, so I might use that a bit more in future. But Andrea, I mean, that's some really important stuff, I think, there, isn't it? Particularly in terms of message to go to the NHS. I know one of the big focuses in terms of the sort of healthcare economy, if you want to call it that, within the NHS, is moving point of care to the most sort of affordable point of engagement between the patient and the healthcare system. So moving those GP appointments into community pharmacy is something really huge for the government and the NHS that they should be taking notice of.
Absolutely. I don't know if Gary wants to sort of top and tail any of that, but being in the PSNC as well, clearly there are massive opportunities for community pharmacy now going forward. The government have recognised it. Matt Hancock has come on, TV several times, as I've just described, calling us the front door of the NHS. But they kind of need to put their money where their mouth is as well. So certainly the National Pharmacy Association hasn't been shy in coming forward, asking the government to do exactly that and put the money where their mouth is and supporting the future of community pharmacy.
I agree. I mean, as horrific as COVID has been, as hard as it's made us all work, and it's been challenging personally when I've seen people furloughed, and yet I've seen my team do overtime and work well into the evening and come in early, and myself as well. I think it's been great that the government has at least paid lip service to that so far. And I think all our jobs, the NPA, PSNC, individual contractors, is now to see that turned into a sustainable future, which involves greater funding, because it's not sustainable as it is at the moment. I think the NHS has a big challenge. Just looking at that slide there, Andrew, 500,000 additional GP appointments if pharmacy shut its doors. We didn't shut our doors. I can see Raj has put in the chat about GPs shutting up shop during COVID. That is one thing that we certainly didn't do. For the vast majority, we may have made the door more difficult to come through if you're more than two people, but we were certainly there for them, and that's been greatly recognised. I'll be talking a little later on about displacement activity, because we'd like to put a label on things. but that's essentially where I would have gone to see my GP, but I can't get an appointment, or I need him to look at, or her to look at something. Could you have a look for me? And, you know, the diagnostic and consultation skills that we've built up, and using them, and how that's taking us away from the dispensing bench, and actually, you know, if not into the arms of patients, then certainly to approximately 2 meters away from patients, and having the opportunity to have that consultation. And for the NHS to recognise that shift, that we've always been the front door, but that front door has been firmly held open, I think, through this really difficult time. And I've said it many times, and I take my absolute hat off to everybody that's working, you know, in the front line, but especially in pharmacy, where we don't normally get recognised. You know, we've lost pharmacists. I've had staff lose family members and friends. It's been a very, very difficult time, and yet still eminent professionals.
Thanks for that, Gary. Well, as Gary mentioned just there, the comments box lit up whilst Andrew was giving his presentation. I can see we've got quite a few comments here. As Gary said, GPs shut up shop during COVID. Raj also there, 77% want face-to-face, but NHS and government need to recognise this and yes, remunerate accordingly. Sunil Patel, Mr. Hancock did not even know that we did flu vaccinations previous years. I guess this is perhaps an answer that a question that either Gary or Andrew can take on. His comment is, have the PSNC or NPA asked him about the fact that he was not aware of this?
So it's always difficult talking to government. The worst minister you can have is an embarrassed minister. Okay, so what that flags is his lack of awareness about pharmacy and what pharmacy does. Thankfully, we know the Treasurer will know. But in terms of what he knows, I think the work the PSNC and most especially the NPA, if he was reading the Sunday Mirror the other day, will absolutely know what pharmacy does and what it's delivering. And just keeping up that constant barrage of actually good news, because if you want that good news to continue, then it needs to be a sustainable service.
Okay.
Yeah, here. And all I would say, you know, obviously, Sunil, he knows now. There is absolutely no doubt about that. He knows now. In fact, what we managed to do was line him up last Monday for his own flu jab in pharmacy. And I think whilst that didn't happen with Matt himself, Mike Patel in London managed to go into Skipton House and do several of the senior ministers and the senior staff in NHS England. So they all had their flu jab from a pharmacist. So they certainly know we provide the flu.
Very good. And Mike, very well done for getting into Skipton House. I remember in a previous life when I made a visit there, it can take about 15 minutes just to get through the security checks at the front door. We've got other questions coming in here around vaccines and supply. Prakash saying we can't get any of the flu vaccines. He understands the NHS are holding on to stock, 30 million doses. When will they release these, and what is the criteria? I don't know if that's a question we're capable of answering tonight. Do we want to take that on or not?
So it's not my understanding that the NHS actually has any stock at all, but they have orders placed. There aren't enough fridges in wholesalers. There aren't enough fridges in the foyer of Skipton House to hold the market's worth of stock. Because if he wants twice as many people vaccinated, there needs to be twice as much vaccine. And you can't load that all up front. And a few people have said, you know, they've had personal difficulties ordering, or, you know, I ordered the same as last year, same as Andrew said. None of us knew what was going to happen. If you tried to top up your order, it was quite a challenge. I think we just have to accept, we get the vaccines, we find the patients, we vaccinate appropriately, tell the GP. and we just do that for longer. It's not the normal September, October, half of November, then it's done. I think this vaccination season will run on, Christmas Eve. Come in and get your cracker, and I'll vaccinate you while you're here.
Okay, thank you, Gary. Well, we've got more questions coming in constantly now, so thank you very much, viewers, for those. I think what I'm going to do is probably come back to those in a few minutes, and we'll try and get as many as we can answered. But I'm conscious as chair that we've heard and seen presentations from Adele and from Andrew, but I'm really keen to hear a little more from Gary. Obviously, the focus of this evening is very much around using data to obtain value, and I suppose really when we're talking about pharmacists and pharmacists making best use of data, Gary is probably a bit of an exemplar himself. He's become so passionate on the subject that he's now something of an authority. So, Gary, I'm quite curious personally where the sort of data journey that you've gone on when you began to realize that the value that data had as a pharmacist. When did that begin, and how has that taken you to the point you are now with PharmOutcomes?
Thanks, Paul. It's a really interesting question, and the answer is at least 4 hours long. So I'll try and get it through, because there are more exciting things to talk about than my past history. But in 2001, I got dragged into the office by the head of medicines management for the Isle of Wight, demanding to know why pharmacy wasn't doing EHC anymore, and he was getting loads of complaints. So I said, I don't know, we're doing it. So he shared the data that he had, and it was immensely powerful. So the data he had was that a year previous, pharmacy was doing 92% of the morning after pill EHC on the Isle of Wight. 92%. That includes GPs, maternity, A&E, everybody. And that was falling like a stone. And we found out why. It's because they made us reaccredit every year, but hadn't held training for 2 years. So, people were falling off the cliff. They were moving around. They were moving on and off the island. So basically the workforce wasn't trained. So we solved that. But it made me realize how important pharmacy was as a service provider, and more importantly, how powerful that data was. And the next thing, I went to an APPG, an all-party pharmacy group meeting, I don't know, about a year and a half later. And it was Howard Stote said, you never provide evidence of what you do. And I'm not one for public speaking, but I have to say, I did stand up at that point and say, actually, you do have the evidence. It's sat in your filing cabinets, in the PCTs at the time. It's sat in your filing cabinets and you are not looking at it because we are providing that data. And then the journey really took off. Last time we had a pandemic, they come around, nothing quite like this one. But this was swine flu, and pharmacy was providing, we were providing vaccinations for flu at the time, but we were also doing prophylactic medication, and they were being recorded against vouchers. And the data requirements for the Department of Health for the PCTs was ridiculous. They needed to know how many packets were left in each pharmacy at the end of each day, how many being handed out, what the batch numbers were, and what the postcodes were of the people that had been handed to. And some poor person at the PCT had to collate all that every day from 31 faxes that were late, etc. So there was no patient data involved. So I'm lucky I'm a pharmacist and I can program. So I knocked up a quick web system and we used that. And eventually what happened was the island actually saved £42,000 because they could see the shape of the data. They could see the shape of the pandemic, and they could shut down the service in good time. They weren't having to keep premises and staff on. Staff could return to their normal work. And Southampton rocked on for another 3 months and only saw another 170 patients in those 3 months, paid all the costs. So that was kind of where it started. And that system is actually now what everybody knows as PharmOutcomes. There are still lines of code from those very early days in there.
Very good. And I guess the other thing I pick up on there, Gary, really impressive. The data gave you the facts. It gave you the the financials to prove the case, and I guess across pharmacy nationwide, that seems to be what we need to do. Looking at some of the comments now coming in again, that seems to speak to one we have here from Mustafa. How do you quantify the value of the services we are providing, as just mentioned?
I can certainly answer that one. I've spent far too much time looking at that and persuading the NHS of the value of that, along with colleagues at PSNC. Perhaps if I talk to that and answer Mustafa's question, and also, does the NHS value the value, and how that feels from my experience talking to them. So I did promise a load of data in my segment here, Paul, and I promised Adele I'd reveal what we were up to. So it's the 29th of September. People are still vaccinating out there in the real world, not in our cozy webinar. So on PharmOutcomes, they've recorded 750,000 flu vaccinations in 29 days. On the Sonar system in London, they've done a phenomenal 125,000. So we're a day away. If I extrapolate what we're doing a day and what Sonar are doing a day, we'll hit 950,000 by the end of tomorrow. Nearly 1 million. And I bet some people are recording them on paper. So I think we'll have done 1 million. And wouldn't that make a great headline? That's amazing. Wow. I think one of the key advantages that we've got this year, and thank heavens we've been working to do it, is we've taken away some of the burden. So all the notifications that they have to go to GPs, clinical safety. We're now writing directly to the GP record. So all those problems are starting to fade away as the GPs get turned on. We're writing the claims to the BSA. So I don't know about, we will have done 800 vaccines in my pharmacy this month. I don't particularly want to go through bits of paper and count up all the different types and who was what and all the rest of it and enter it into the Manage My Service portal at the BSA. Hopefully, if things go to plan, then on Thursday morning, people will be able to log in. They'll see what they've got. They'll be able to just say, yes, that's exactly what it says on PharmOutcomes. Excellent. If it doesn't say what it says on PharmOutcomes, don't phone me. And this year we launched something called Pre-Consult, which in my pharmacy sat there with a stopwatch. Normally a flu vaccination in our pharmacy takes 7 minutes and 50 seconds. It now takes 1 minute and 40 because the patient has entered their details into Pre-Consult before they're near any of our staff. So it's simply a clinical check, an acute vaccination, a brief discussion, and you're on your way. And of course, people don't hang around afterwards, so we're getting through them. All those three together have been very much part of what we've tried to do to help make community pharmacy as efficient as possible during this vaccination season. And I hope in some small way that's made people's lives easier, because wouldn't it be nice if data made people's lives easier? But it rarely does, because you've heard of garbage in, garbage out. Well, you've got to put the garbage in the first place. You've got to put the data in. And one of the wins of Pre-Consult is that the pharmacy doesn't have to put the data in. But once you've got the data in, you only have to enter things once, but you can then use it many, many times. You enter once and use often. And for the people watching and listening, there are a couple of thoughts I've had on how you can use the data from any service, actually, but particularly from flu. And the first is to predict your patterns. So I'm sure, like the rest of you, you've ordered your flu ready for next year. You will know what the pattern is from previous years. You can look and see a daily uptake and see how you should phase and how you should persuade your supplier to bring it forward or shift it back as necessary. And the other thing that it was actually, I've had one contractor contact me in the 9 years I've been recording flu vaccinations electronically. One contractor who said to me this year, is it possible for me to get the names and addresses of the patients I vaccinated last year so I can write to them and encourage them to come to me again this year? One person. And I thought to myself, what a fantastic idea. And that's growing at the moment in my brain, because I think of our GP colleagues doing call and recall. And for those of you that aren't familiar with that, that's the ability to look in your patient record and say, right, these are people that I need to do something with. That's the call part. And then the recall is they've had it in the past. And so I need them to come and have it again. At least pharmacy can do the recall part now, because the pharmacy has the data on who's been vaccinated. So I'm certainly going to be building up thinking on that and exploring GDPR challenges, which all look to be good at the moment. And so hopefully I'll be able to share in the future some thoughts on that and how pharmacy can build that up themselves and, you know, maintain that relationship with patients. I'm sure we'll be looking at the poll towards the end. Services were strong and then fell back. Actually, I strongly believe that services are probably the best way to make that relationship with the patient. Relationship with the patient is very often between the pharmacist as an individual and the patient as an individual. And I realize there are many on here who aren't independent pharmacies, but it's certainly one of the many strengths of independent pharmacies is that constant face and getting to know your patients.
Okay. Well, I hope Gary is not going to sway the vote too much on the poll. We'll be taking a look at the results in a few moments. If you have cast your vote, stick to your guns, and we'll see what the thoughts were before we kicked off. I'm just trying to look through a few more of these.
Could I just say,
here.
Sorry, Paul, there's two valuable things I want to say. Oh, I think they're valuable, if I can just get them across. The first is just to answer that question about how are the services valued. So we've evaluated the TCAM service that's going to become the discharge medicine service, and the savings to the NHS are multi-million, evidence-based. But the challenge to us all the time is the NHS doesn't pay for value, it pays for cost. It extracts the value from what you've done. However, recognizing value can mean that an ad hoc service becomes a paid for service. So if I think about what we've done as a profession, flu is the obvious one. You know, we collected the data on that. We evidenced the value of what pharmacy did, and it became a service. CPCS, you know, people believed it wouldn't work. It almost got pulled in the Northeast. We gathered the data. We started to crunch it, evidence the value, and now that's starting to grow into a really big service. We've got TCAM, which is going to become DMS next year, the discharge medicine service. Capture the data, huge value, that's going to be commissioned as a service. And then Hep C, which launched at the beginning of this month, exactly the same pattern, capturing the data, making sure it's evidenced and shown to commissioners. They are the only services that have been commissioned. If you don't collect the data, you're not going to get a service commissioned, which comes to the displacement question before. So if you are going to get paid for handling displacement work from GPs, you will have to record it. So GP CPCS starts on the 1st of November. Okay, it's not national, it's small pockets, and it will grow. They're keen to get it live before winter so people can take advantage of it. We will have to record it. It's in the same form as CPCS is, but that will rapidly grow into a huge evidence base that answers the question to government that the NPA have been challenging them with about these 492 additional GP appointments. We are the solution to that.
Okay, thanks for that, Gary. I guess that probably speaks to a lot of us. If you want to win services and you want to expand what you're doing, if you can make a solid business case for it, you really are, I guess, making the job of the payer that much easier to justify the payment. Okay, so Gary did mention the poll that we've been running in the background there since we started. I am now going to press close on that, and we're going to take a look at the final results. Now, this is the first time I've used this particular technology, so I hope everyone at home can see the results. You should be able to just click into the polls tab on your browser, but fear not, I am now going to announce the results. And Gary, I think you'll be interested to see a fairly even split, actually. I think services was your particular bet. So Andrew, perhaps we can come to you and get your thoughts on these results. So for those that can't see, I've just announced them. We asked, in your pharmacy business, what is the best driver of patient loyalty? Option 1 was deliveries, just 6% of you thought that was the case. Nominations for England only, that scored highly with 29%. We did not have an overall winner. We had an exact tie. So services, 32%, and electronic repeats for England only, 32% as well. So Andrew, pretty much a split vote there.
Yeah, any poll tells a question, demonstrates the answers to the question. But in this particular case, we talked about data being key. The one that stands out for me is services. And I think, to Gary's point earlier, if we are to move, more towards a service-driven type of contract that the government want to take us on that direction, then we've got to record, as Gary says, the services we do, and that evidence is the value we provide. I think, as Tamsin had asked a question in the Q&A, can that call and recall be used for the COVID vaccination? We want to be 10 steps ahead, and I think I come back to you guys, the data maestros, and Gary is one of those as well. The challenge for you guys is absolutely provide the mechanisms, provide the data collection tools so we can do that easily in the pharmacy. And the more that's done by the patient, like Gary said, before they come in, even better, because it's not taking up our time. And I think the COVID-19 NHS app is an example of that, how quickly things can be done. I know there was a trial on the Isle of Wight first off, and it maybe didn't go as smoothly as perhaps it could have done. But this current app, I think it's got, 10 million users already in what? It's only been out a few weeks. And I've used it a few times, and it works. And I just think if someone can develop an app that actually demonstrates you've had your COVID vaccination or you've had your flu vaccination, and you as an individual have your patient record. It's not necessarily shared unless you want it to be shared, but pharmacy gets to use that data in an anonymized way to demonstrate its value. Then that is got to be the future, and that future you guys can create and help that. That's what I would call the techie element of our face-to-face. So we can do the face-to-face, but we need the techie element done by the gurus just to drop in and make it seamless for us so we can focus on patient care and face-to-face. And I think that's a challenge. And I think that data capture is getting smarter every year that goes by in pharmacy. But to Gary's point, we've not been very good at that in the past. And I think that's why it's taken till now before we started to get traction with some of the people that pay us. Another good example is the EY report that the NPA commissioned. I'll get that in. That's all about data. It's all about collecting data and representing that back to the government, and making our case around the data. So it is so important in so many ways for our future, really. So thank you to RWA, and thank you to Gary and his involvement in shaping the data that we all use now every day.
Thank you.
And it's going to get better.
And I'll just jump in on that as well in terms of Gary mentioned there about garbage in, garbage out, but you need to put the data in once to be able to use it multiple times. So, like what we're currently doing, we have a kind of small pilot project with a few of our customers already that is allowing us to track the flu that was given last year. So we were able to suggest to them already this year, these are your repeat flu patients. Obviously, that didn't take into account the predicted flu patient increase that we had, but also we then used the cocooning patients designed by the NHS to predict who were the most vulnerable patients that needed to get the flu jab first when it came in, and again provided that to our customers, and then on the flip side of that, we're able to use the data over and over again, the same data, because we're then able to utilize it at the end product to say, okay, you're actually after getting paid all the right amount for all your flu. So like as Gary was saying, that the data goes in correct once and you've got traction on it to use it so many times. So if we're able to, Gary, this year, we can then next year predict for all of our customers, and through PharmOutcomes or whatever the platform will be, these are the patients that are first on the list for flu. We utilized it already for MURs, which obviously has moved on, but the data, the information, the answers is already in the data, and it's about the pharmacists, it's about the business owners asking the right questions to get the answers out of them.
Yep, 100%, Adele.
And you can get multiple times.
Okay, thanks very much, Adele. Well, I was literally in my head just wondering how much longer we had left for this webinar. I thought I might get some kind of message from our webinar host closer still, but instead our RWA office lights actually switched off on me. A clear message, I think, if ever there was one, that we're about due to wrap up. I have in fact been told that we're pretty much out of time. A few more things for you guys. I suppose firstly, just to thank everyone that's taken a bit of time out of their evening to join the webinar. Thank you so much as well for all the interaction, all the great questions we've had. My apologies to those of you that have taken the time to type something in if I've not had time to read it out. I know the guys as well will see alongside me. We have had a lot of really great comments and questions. I suppose I'll just put it back to the panel very briefly before we do wrap up, if we have any closing comments or thoughts, and perhaps go to you, Gary. Any final words for our audience?
The data is there. The key is to make it work for us. If we're putting the energy and effort in to record it so others can see it, we need to find ways of making it work for us too. Perfect.
And Andrew, from your point of view?
Yeah, I think the National Pharmacy Association has already demonstrated the power of data, if I'm honest. So the things that we've done with data just in the last month, I never thought we'd get the traction we have done. And Gary's pointed to the campaign in the Daily Mirror as an example. The public are 100% behind us, or 74% are. But I think that's a massive leap, and we just got to use that to our advantage and keep repeating those same messages, because I think that's perhaps what we fail to do sometimes. We drift off, we get too much in the detail. We're pharmacists, we love the detail, but stick to the top line data messages. And you guys in the data companies, keep doing what you're doing, because without you repurposing the data, we can't really put a story around it.
Perfect. Okay, so a great message there for lobbying, but also a nice message, I think, for our audience tonight. The public does value you, is behind you, and appreciates all the hard work you're putting in. Adele, from an RWA point of view, any final thoughts?
I think just as Gary said, the data is there, and it's there in multiple sources, and it's companies like ours who are able to utilize and create partnerships with these great sources of data and put together a whole picture. So there is multiple sources of data, and each part of those sources give you a part of the picture. But being able to utilize multiple sources, whether it's NHS data, whether it's PharmOutcomes, whether it's PMR, whether it's NHS payments, to create a much bigger picture for the pharmacy teams, I think it will allow them, to grow their business. And grow their services. I suppose effectively grow the margin, and the profit, I suppose, is the end game, isn't it?
That's the end goal. All right. Well, look, thank you ever so much, everyone, for taking the time this evening. Just as a final piece of housekeeping, just to let everybody know, if you did miss sections of this webinar, I think our friends at Pharmacy Show are actually going to be posting it on their website. So you can watch the bits you missed, or if you enjoyed it so much you want to see it again, I'm sure that is fine as well. You can visit the site in the morning. My thanks to Gary, to Andrew, Adele. Thank you very much for watching, and good night.
Thanks very much.
Good night, all.
Thank you.